Good afternoon, it's Dr. Paul Gerstenberg here, Gerstenberg Clinic in Port Neches, Texas. Today we're going to talk about, no, not COVID. Another talk on coronavirus might make you, look at something else. But I want to talk today about pain, specifically knee pain. And it's the most common joint in the body that we have trouble with is different types of knee pain. Osteoarthritic knee pain is the thing that's more chronic, but all types of knee issues can cause pain and disability. So if you've had symptoms of swelling, clicking, locking, of course, ongoing knee pain, we want to catch you early and not wait till you've had pain for 5 years or more until you're just facing knee replacement. We'd like to catch you and see symptoms way before then, but if you're not a candidate for knee surgery, can't do it for some reason, we probably have some options to give you. So we look at a patient and evaluate them, first of all, with a thorough history, how long and what situations are causing knee pain and discomfort. And then we do a pretty thorough examination, dynamic and static exam, looking at presence of swelling, laxity, doing various stress testing on the knee, and look at dynamic ambulation, walking. We want to assess for grinding, clicking, of course, locking, stability testing, and then based on the history and the findings, we really would determine treatment. Of course, that's going to be true for pretty much any condition in the body. And we want to start with the non-invasive treatments, and we have invasive, and then of course there's like knee replacement, kind of three different areas of types of treatment. So the non-invasive stuff would be like oral medications, prescription medications. That's not my goal to cover that today, but I want to make sure that you know that there are a few options, specifically with supplements, one that's turmeric or curcumin. This is certainly something that's available for over-the-counter use. You have to be careful with it, just like any prescription medication. It is certainly something that can be hard on the stomach, harsh on the stomach if you have gastritis, have peptic ulcer disease, bad reflux. Cumin or turmeric can be a little harsh on the stomach, and so don't just take that lightly. You might want to take it with food, and you certainly want to be wary of it causing ulcers if you've taken it long term. Other things to take would be something like CBD oil. You can take that internally. Of course, there's lots of other types of things. There's fish oil and N-acetylcysteine and other supplements that can help as anti-inflammatory agents. And then one that most people are not aware of is quercetin. Quercetin, starts with a Q, is anti-inflammatory. It also has antihistamine effects on the body. So it can have some great benefits, and what's most important is it's not hot on the stomach. It is not harsh on the stomach, so folks with gastritis, ulcer disease, prior ulcer disease can usually take that pretty safely. Of course, external things you can put on the knee, such as biofreeze, cold agents, menthol type agents, ice packs, there's wraps, straps, braces, any types of things like that you can use externally. Other non-invasive treatments would be things like physical therapy, formal versus home-based physical therapy for knee laxity or for knee strengthening. And of course, there's bracing and supports that can be helpful to stop any swelling and improve stability and laxity while you're allowing the knee to heal. There's more invasive things that we can do, such as what the main thing I wanted to share with you is we have, of course, most people know about cortisone injections, Kenalog, triamcinolone, other types of injections, and we've done a variety of those over the years. But those tend to be I'll be more on the anti-inflammatory, more destructive side of knee therapy. But the thing we're excited about is using that which is natural to the knee, such as hyaluronic acid. We want to put in the knee what was intended to be in the knee to try to help improve the knee structure and function. So things such as hyaluronic acid, or even platelet-rich plasma. What PRP is, it's drawing one's blood, spinning it down with a special centrifuge technique, and then injecting it back into the knee or joint, or we can use applications all over the body. We use it for aesthetics in the face. We do male and female sexual dysfunction like the O-shot and P-shot, but I've had my elbow injected. I've injected bunions and ankles and shoulders, and it's very low risk, and there's really no side effects because it's the person's own plasma that we're injecting in there. So PRP is a thing that can be done very easily in the doctor's office, in my office, and then we do other things. I don't do stem cell therapy here, but that is available in certain areas of the country, in certain clinics, and they can get very expensive and be just the same price as doing an actual knee replacement or joint replacement. And it gets to be a lot more complicated process, of course, as the higher up in the types of treatment that you do. And then usually what I'll do is combine a variety of those types of treatment where we can rehab or improve the knee structure and force function before we need to even think about doing knee replacement. Of course, knee replacement's kind of the ultimate thing to do if things aren't working out so well, but we want to catch you way before that's even ever a question. If you're ever, unfortunately in that situation and you need to avoid or you cannot do surgery for some reason, give us a call, look us up. Or if you want to be more proactive, if you're having early symptoms, say, a couple months, 6 or 8 weeks long, we can do x-rays right in the office. We have a mobile fluoroscopy unit, and all of our injections are done with a live x-ray using fluoroscopy. It's a low dose machine. It's very, very, very safe. Some say you don't even need to use any lead shielding to do it because it's so extremely low dose x-ray exposure. But anyway, there are some natural options, some things to think about. If you have any questions, give us a call and come in for a consultation at the clinic, Gerstenberg Clinic in Port Neches, Texas. Have a nice day.